Hello, everyone, and welcome to today's webinar, which is partnered with the UHN, EPIC AT, and AGE-WELL. My name is Ash McCaskill. I am the programs coordinator at AGE-WELL and for EPIC AT. I'm joined by my esteemed colleagues, which I will introduce shortly. But thank you so much for being here. Today's the very first webinar of the Elevate EDI series. So this is a very big deal, and we're so excited to be launching it today on a webinar on ageism, gendered ageism. So first, before we begin, let me just share some accessibility points just to make sure that all of you can participate in a way that you feel comfortable with and that you know where to go as things happen. So first off, I just want to say that we do have that today's webinar is being recorded and will be available on our AGE-WELL YouTube channel after the event, and also our partners will also share that link. There is also closed captioning available if anyone needs that, and you'll find that at the bottom of the window with the icon that has two C's, which represent closed caption. When you do pick that, the text, there will be like a little text box that will appear at the bottom of your window. And you'll see that it appears in a black background with a white text. And please note that it is automized, so sometimes there might be some inaccuracies. And to ensure that everyone has a good experience today, we want to ensure that all speakers and all attendees show respect and kindness while sharing the space. So any form of harassment that is shown, that person will be removed from the event. Please know that at the end of the webinar today, there will be a Q&A. That Q&A, you'll find if you want to pose a question, you'll see the Q&A box at the bottom of your Zoom window. Please feel free to pose a question when that time comes. And also we encourage you to use the chat today. So for example, I'm from Montreal, so share in the webinar today where you are Zooming in from. We would love to know. That would be great, because we definitely have a representation of coast to coast today, even with our speakers. So before we begin, I'd like to introduce today's moderator. Azadeh Yadalahai is a senior scientist at KITE and an associate professor at the Institute of Biomaterials and Biomedical Engineering at the University of Toronto. Azadeh leads Sleep DB, the first soundproof sleep laboratory in Canada. Her research focuses on improving chronic respiratory disorders during sleep, such as sleep apnea and nocturnal asthma. This includes discovering novel physiological mechanisms that narrow the airways during sleep and makes breathing hard or impossible. She is also developing and commercializing wearable technologies for improved diagnosis and treatment of chronic respiratory disorders. And just on another note, I just wanted to say that Dr. Azadeh and Dr. Samantha Sandassi, who is also the main manager of the EPIC AT platform, are very much the brains behind developing this idea of doing an EDI series. So I do just want to say thank you so much, Azadeh, for doing this with us today and acknowledging all the work that she does and advocating EDI and advocating for communities that need more recognition. So thank you so much. And I will pass it over to Azadeh to present our esteemed speakers today. Thank you so much.
Thank you very much, Ashley, for such a nice introduction. And it is a big pleasure and honor for me to be here today to learn from our outstanding presenters and then be involved in this discussion. So without further ado, the Elevate program is a partner EDI webinar series between EPIC AT, AGE-WELL, and UHN, focusing on a diverse programming of health researchers, advocates, and healthcare professionals, delivering webinars on ageism, gender, and allyship. This is the first webinar that will focus on gendered ageism. And it is my honor to introduce our first presenter, Dr. Paula Rochon. She's founding director of Women's Age Lab, a geriatrician and senior scientist at Women's College Hospital and ICES. She received her medical degree from McMaster University and Masters of Public Health from the Harvard School of Public Health. Dr. Rochon is a professor in the Department of Medicine at the University of Toronto and is the inaugural Arturo Chair in Geriatric Medicine at the University of Toronto. She is a fellow of the Canadian Academy of Health Science and a fellow of the Canadian Geriatrics Society. Dr. Rochon has a strong record of federal funding and has published more than 300 papers in peer-reviewed journals. She held the role of the Vice President of Research at the Women's College Hospital for 12 years. Dr. Rochon chairs the Canadian Institute of Health Research, or CIHR, Institute of Aging Advisory Board, to support research and promote healthy aging across Canada. She is a deputy editor of the Journal of the American Geriatric Society. She was a member of the Ontario COVID-19 Science Advisory Table when it was active, where she chaired the congregate care setting working group. She has received research distinctions, including being elected to the Canadian Academy of Health Science in 2013. She was awarded the Eaton Clinical Researcher of the Year Award from the University of Toronto in 2020, the Eugene Stewart Award for the Best Thesis Supervisor from the University of Toronto Institute of Health Policy Management and Evaluation in 2022, and the President's Impact Award for Excellence in Research from the University of Toronto in 2023. Dr. Rochon is committed to the development of trainees and new investigators in aging research and making valuable contributions to our future understanding of aging. Her team has won prestigious research awards, presented across Canada, and published in peer-reviewed academic journals, disseminating key learnings and important findings from their research project. And I could tell that I've heard many of those from her trainees working with her and how impressed they are with the training they got from her. Our next presenter and panelist is Sherry Baker, is the co-chair of AGE-WELL OACAC. She's an independent consultant and has been the contracted executive director of the BC Association of Community Response Networks since 2010. Sherry has sat on and chaired many provincial, regional, and local boards over the years. She's the co-chair of the Older Adult and Caregivers Advisory Committee for AGE-WELL. She was the executive director of Ishtar Transition Housing Society from 1995 to 2006. She was awarded the Canada 125 Medal and received the Queen's Diamond Jubilee Award Medal in 2012. She has been awarded 3 Paul Harris Fellowships by Rotary International. She was awarded the Elder Abuse Awareness Action Award by Simon Fraser University Gerontology Research Center in 2018. And the Dr. Elizabeth Podnick Award for Elder Rights in Canada in 2022. Sherry holds a Master of Arts degree in Applied Behavioral Science from the City University in Seattle, a Bachelor of Home Economics from the University of British Columbia, and a Diploma in Business Administration from Fraser Valley University. It is such an honor to have you, Sherry. Thank you. And last but not least, our other panelist is Dr. Olive Bryanton, Older Adult Advocate for AGE-WELL. Dr. Bryanton from Hampshire, Prince Edward Island, joined OACAC in 2018. As an educator and passionate advocate for older adults, Dr. Bryanton was instrumental in establishing the first multi-purpose senior center on PEI, which celebrated its 25th anniversary this summer. She was also instrumental in establishing the Seniors College affiliated with the University of Prince Edward Island and served as the first president. In 2000, Dr. Bryanton received an honorary degree from the University of Prince Edward Island for her advocacy work with older adults and lifetime learning in 2012. Dr. Bryanton was awarded the Queen's Diamond Jubilee Medal from the Federal Minister of State for Seniors, Honorable Alice Wong, for provincially and federally contributing to seniors. In 2017, Dr. Bryanton was appointed by the Minister of Health of Prince Edward Island to serve as an executive advisor for developing the recent Seniors Health and Wellness Strategy for Prince Edward Island. She is currently a lifelong learner and defended her PhD in 2018. She also received the Order of Prince Edward Island in 2021 and the Queen's Platinum Jubilee Medal in 2022. In addition, in December 2022, she was appointed to the National Seniors Council and the International Longevity Center as an ambassador in 2023. Currently, she is working on a postdoctoral fellowship at the University of Prince Edward Island under the supervision of Dr. William Montelpere. That is impressive. I'm so amazed with all the achievement and the passion for learning and teaching. Thank you. So without further ado, I give the mic or control to Dr. Paula Rochon.
So thank you so much. Can you see the slides?
Yes.
So thank you for the lovely introduction that you gave, and it's a real honor to be here and to be able to talk about some of the work that we're doing on gendered ageism. So I'm going to start by talking a little bit about Women's Age Lab, which I think very much relates to the conversation that we're going to have today. So Women's Age Lab, we've just had our second anniversary, but it's the first and only research center, to our knowledge, that's focusing on older women. And I just want to emphasize that I think that in itself is quite an incredible statement. You know, you think that, you know, as a country here, we're about to become a super age society where more than 20% of our population will be older adults, people over the age of 65, the majority of whom will be women. And then when you think about it at an international level, you know, we're approaching a time when there's about 1 billion people who will be over the age of 60, again, mostly women. And I think it says a lot to think that, as I say, to our knowledge, we're the only research center that's really focusing on this group. So clearly something that we want to think about and something that we need to address. Now, when I talk about the fact that we're focusing on older women, you know, it's interesting. My husband always reminds me, well, what about men? Or sometimes people say, what about us? You know, we're not including everyone. And I want to just remind you that when you focus on women, you learn also about men, because, you know, when you just think about older people as a single group, you miss out on those important differences. And so our goal is to improve the lives of older women, but in so doing, we're also improving the lives for men as well. So when you think about aging and when you think about women and aging, I think it's vast. I mean, it impacts just about everything we do. And so as part of the work at Women's Age Lab, we had to start by honing in on a couple of priority areas that were where we wanted to start. And so we're looking specifically at issues around reimagining aging in place and caregiving. Very important issues for women, and where there's a lot of gendered pieces going on there. You know, for example, the majority of people in long-term care are women, and the vast majority of people who provide unpaid caregiving are women. So these are very important pieces. We're also looking at optimizing therapies, optimizing drug therapies. You know, there's important differences between women and men here, and it's important to think about how do you optimize the prescribing for women to ensure that we reduce issues related to adverse events and improve medication safety. And then one that's becoming
increasingly important, and our third area of focus for Women's Age Lab, is promoting social connectedness. I mean, there's so much discussion right now about, how people are perhaps more isolated than they want to be. And this is, again, a particular issue for women that can also impact their health that we want to discuss. Now, you see here in this nice visual that we have that in all of these issues that we talk about, there is this thread about the need to address gendered ageism. I mentioned with reimagining aging in place, majority of people in long-term care are women. Why is that? Why is that happening? Optimizing therapies. Why is it that women are more at risk for adverse drug events? What's leading to that? And the piece around social connections. Why is it that women are more likely to be experiencing loneliness? So these things all relate. So let's talk about ageism. So ageism is something that I think we've heard a lot more about in the recent past, particularly I think during the COVID time period. But basically, it's a prejudice against people based on their age. And this was something that was a phrase that was first coined by a geriatrician, Robert Butler, many years ago. And it's something now that, as I say, we're becoming increasingly aware about. Now, it's interesting when you think about aging and you think about ageism, you probably are thinking that it impacts mostly older people, but you also want to think about the fact that it also impacts younger people. So you'll hear things like older people are too old to do this, or phrases like that, which talks about how ageism impacts older people. But then think about younger people. They are often told, for example, when they're thinking about work, you don't have enough experience, you haven't done enough in the field. They also experience ageism. So it's something that impacts people, especially on both ends of the age spectrum. As I've already said, given the importance of thinking about this about older people and the fact of the demographic here in Canada and around the world, it's really important that this is something that we address, especially for women who make up the majority of that population. So while you've heard a lot about ageism, I think it's fair to say that you haven't heard as much about gendered ageism. And that's basically discrimination based on not only your age, but also your sex. And I think this important piece is just often missed out. But in fact, it's kind of a double jeopardy for women. It's something that's so common that I think it often doesn't even get recognized. And it's something that we'll see in the way we talk about things from a cultural perspective. You'll see it in healthcare, you'll see it in different kinds of policies. And it's ageism itself has now been considered so important that it's like a social determinant of health. It's one of these sort of non-medical kind of factors that impact your health. So it's something that's incredibly important. And as I said, it's kind of a thread that runs through many issues that are facing older women. We've talked to a number of people, and especially older women, to get their thoughts about some of the things around ageism. And, these are some of the things that people have said to us. Ageism is alive and well, unfortunately. And another quote that we had from a woman that we were talking to said that discrimination against older people and older women, I think there's a lot, stereotypes, which only exacerbate the problem. I don't like to be treated that way by healthcare workers. Like, I know when I'm being treated that way, it's just unacceptable to me. And I don't have a lot of choice because there's not a lot of options. So people see it, they experience it, they talk about it, and it doesn't make them feel good. So this is something that's very important. The WHO has done some really great work, and they've published a piece called The Decade of Healthy Aging. And they've also done important work around ageism. And I like the way they've conceptualized it and the way they've organized it. And I think this structure is really helpful to thinking about ageism in our own experience, and particularly when we think about gendered ageism as well. So for many, it can be self-directed. People can internalize it and say, oh, I'm too old to do that, or that's something that only younger people should do, or make comments like that are probably not appropriate, but people do that. People also experience ageism at an interpersonal level. It's other people saying things to you that are really negative related to age or gender or the combination of the two. So we'll see it in things like, for example, comments people might make around a birthday. Or you might see it, for example, in a birthday card, saying, oh, you're reaching this age, therefore you must be forgetful. These are sort of things that are, again, not necessarily true, and are sort of stereotypes that are quite hurtful. And it also occurs at an institutional level. And I think we want to think about that too carefully. It's also about, for example, applying for jobs. What age is it that people might expect as that you need to be to apply for certain jobs? It might be access to healthcare, and saying at a certain age, certain kinds of interventions may not be available to you. So it applies to many different things. It also applies to research and clinical trials and who's included. So these things all are very important, and as you can imagine, can turn around and impact your health. So ageism and gendered ageism is so pervasive that I don't even think we realize it's sort of all around us. I was doing a walk in the UK not long ago, and I started to think about, how could ageism and gendered ageism impact something like walking? And when you're walking for a long period of time, you have a lot of time to think. And walking is really important. It's supposedly one of these important activities. It's not really very costly, that can improve your mental and physical health. I mean, it's a really good thing for you. But what people may not realize is that women of all ages are much less active than men. And, part of this goes back to, times when it wasn't really acceptable for women to be physically active, and certainly wasn't acceptable for them to be out on their own or doing things like walking. And that kind of thing is still kind of pervasive, and that impacts health. And, globally, they say that about a third of women are inactive compared to only, about less than a quarter of men. This is an important distinction. I also noticed when we were out walking that of the people that we saw, we would see women walking that we might pass. And I'm talking about walks that went on for days. These were long walks. But if we saw people on bikes, which is a bit more of a maybe aggressive form of activity, was much more likely to be a man. So if you think about it, this idea about, discrimination based on your sex and your age plays out in a variety of different ways, some of which are expected and some of which are not. Now, here's another way that gendered ageism can go on to impact your health. In a way that perhaps you might not have thought of. And I love this figure, and this was created by Joyce Lee, who's joining us today on this call. And it's looking at something called the pension gap, but it can also perhaps just speak to the idea of the income gap that older women face. So if you look at this scenario and you look at the top here, and if I think about someone like people in my mom's day, for example, when she would have finished school, her high school, there really wasn't an expectation that women would go on and enter the workforce. Like many women at that point went and got married. They certainly weren't encouraged to go on and get additional education. especially in things like the sciences. So if women were entering the workforce, they often went into jobs that were lower paying. And then, as you can imagine, then and now, women will take time off for caregiving and child raising. And often women, when they did that, didn't necessarily come back to their jobs. But when they did, they had that gap in their career. That contributed perhaps in part to lower earnings for women over time and less perhaps opportunities for advancement. And then, of course, women are more likely to be caregivers. So later on in their career, they also may have been expected to take time off to care for family members or older relatives or things like that. So as a result of all of this, for women who were in jobs where they were given pensions, and that would again be a minority of women, they end up with less lifetime earnings. And that means in the end that when they've finished their work experience, their pensions are considerably less than their male counterparts. So around the world, it's estimated that pensions are about 26% less for women than for men. So how does this kind of lifetime of, maybe discrimination impact people when they're older? Well, it may mean that people like women who have less resources are less likely to be able to pay for healthcare costs that aren't covered by insured services. It might be things like glasses. I mean, I'm wearing glasses. I couldn't function without them. They're expensive. Or it could be about getting different kinds of hearing aids, which allow people to connect socially. So it could be things like that. It also may mean that it's less easy for people to get connected in a variety of different ways, to pay for opportunities, for joining networks, for going on trips, for traveling, whatever it is that people want to do. And that could lead to more social isolations that can impact your health. Could also contribute to some of the digital literacy issues that older people may experience. Technology is expensive if you're paying for your iPhones and computers and iPads. And, maybe that's not always affordable. And we know how that's so important now to some of our connections. So these are important things to think about. And it relates to the sort of discrimination that women have faced throughout their lifespan that impacts them and their health in different ways. So what can we do to act? So as I said, I think it is gendered ageism is really, in my view, a largely neglected social determinant of health, and one that we see in so many ways. And women are considered, especially older women, often invisible. They're just not part of the conversation. So what are the strategies to combat this? Because there's a lot that we can do. One is thinking about intergenerational interventions, older people working with younger people, making people aware of some of these issues and discussing solutions together and sharing people's knowledge back and forth really helps to reduce this kind of discrimination. There's a big need for education and research in this area, and that's what we're talking about today, making people aware of things that are happening that perhaps they're not necessarily thinking about. And then there's also the policy perspective. How do we change some of these barriers that are put in there that don't need to be there, that we can address in very different ways? So healthcare providers, what can healthcare providers do? I mean, I know that there'll be healthcare providers listening to this conversation. Well, one of the things that they want to do is to think about how does sex and gender impact the treatment that they provide? And often when people are making recommendations, they don't necessarily think about how this may impact women or men differently, or think about some of these gender-related social cultural pieces. So, for example, if they're making recommendations for things that may need to be purchased and it's not covered by health insurance, how does that impact a woman, for example, that may have less financial means? Or just thinking about some of the different components. For example, we created an algorithm called Drugs recently to help healthcare professionals think about how they should review medications when they're prescribing for older women and men. And one of the pieces we incorporated in here, I think for probably the first time, is how do you consider sex differences when you're making prescribing decisions, and how do you consider gender differences, like women being more likely to be caregivers, and so therefore not having someone to help them with their medications if they need it. Or, for example, that women are more likely to experience drug side effects. How do you incorporate this into your prescribing decisions? We also want researchers to think about this as well. One of the key tools that we have is to think about the importance of using sex and age disaggregated data. Often we have this data, but we don't use it. And by disaggregating whatever you're looking at by sex and age, you start to see patterns. For example, if you're looking at chronic conditions become more common when people are older. So you need to look at different age groups. And chronic conditions differ between women and men. For example, arthritis is more common in women than men, and that increases with age. So by looking at those nuances, we learn about women and men, and therefore can address things so that we're treating women and men in the best way possible. Something that we can all do. And we have a module here that's, I think, very important in this regard to think about how you would approach this. It's a very important toolkit that can be shared by people in terms of thinking about sex and age disaggregated data and how do you actually put that in place. Community members, people like on the call today, need to think about the impact of gendered ageism and have discussions about it and think about it and speak up when people are saying things to you that are negative or you don't think are appropriate, because that's important. So with that, I just want to thank you, all of you, for inviting us to talk about this important issue today. And just want to, again, bring to your attention that this is something that's incredibly important. It's something that impacts older people and especially women, and something that we can address. And in so doing, we can really make a contribution to improving the lives of all older people, women and men. Thank you.
Thank you very much, Dr. Rochon, for the outstanding presentation, and then also for such a diverse coverage of the topic. Thank you. So if I would like to ask our panelists to turn on their camera. Thank you, Olive.
All right, there we go.
Hi, Sherry. Okay.
I know, I don't know why it seemed like it was stuck. Anyway, here we are.
That's wonderful. So I would like to start with the first question, and then feel free to say what you think or how you would like to approach that. And as the first question would be, could you tell us a bit about your interest, or exposure or interaction with this topic, with the issue of gendered ageism? And what do you think about that? Olive or Sherry?
Thank you. When I was a young woman finishing high school in the 50s, we had three choices. We could be nurses, we could be teachers, or we could be secretaries. There were a few women that were breaking the barriers, but they were few and far between. So I have experienced, almost exactly what Paula talked about. Stopped working when I had children and so on. And then when I had to go back to work when I was 51, I couldn't even get the full Canada pension. I had no pension. Had to go back to work. I went back to university and got my master's then. I got my master's when I was 55. So I haven't had as long a period to work. So I am now almost 85 and still work full time. And partly because I need the money, obviously, to keep, and I have pretty much saved enough now that I could stop working if I wanted to. But I like the work, and I'm doing important work, and it's important, and it's keeping me active and my brain active as well. So what I'm experiencing now is people are saying, "Oh, you're still working?" I mean, as if there's some kind of a weird thing about this, and you don't look your age. And I'm going like, what am I supposed to look like? And I think that's a form of ageism. And it's a form of ageism that other people experience who haven't got the same experience as me. If they look, if they don't look what they're supposed to, what people think they should be looking like, or doing things that that the rest of the people aren't. A lot of it is around if people have economic security when they're 65 or so, then they have more of a choice than I did. But then they just, don't think that they can work anymore. And then that attitude has spilled over into the employment world as well. And employers think that if they hired older workers, they'd be too high maintenance, not realizing that they're not going to get pregnant. They've got great skills, they've got great experience, they've got great work ethics, and they can still, most of them can still learn. So our whole society has got this gendered ageism attitude towards it. So I think Olive might want to add to that, because she's had different experiences, but just as much the same in many ways.
Thank you, Sherry. Can you hear me okay?
Yeah.
Yes.
Yeah. Okay. Well, certainly Paula brought out many issues around ageism for both men and women, but certainly women are impacted more. The inequality in society from the time women are born right on through. And I have a story that really clearly shows this. This is a person I know. She did have an education. She was a teacher, and but when she married, she didn't have to give up teaching, but she and her husband had 10 children. And she thought it was cheaper if she would stay home and look after the children, as opposed to having to pay out a lot of money to care for them. So when you think about 10 children, you're out of the workforce for a long time by the time the 10th one actually is independent enough to be that the mother can leave the home. So as a result of her taking the time to raise her children, she was not in the workforce very long. So come pension time, of course, she did not have a pension herself, but she had paid a bit into Canada Pension. So now she enjoys the luxurious amount of $23 a month from Canada Pension. Her husband had a job that did have a pension, and they both, their dreams were that his pension would really help. Her husband died, so the pension was cut in half. As a result, after he died, she could not afford to stay in the home that they built for their retirement. So she ended up, one of her children bought the home, converted the 2-car garage into a suite for the mother. And she's very happy with what has happened, but her life could have been very different had her finances been much better. And just I want to mention something around when we talk about activity, about women being less active. We never take into consideration the amount of activity it takes to be a homemaker and a gardener, and maintaining your home. That's activity, and sometimes it's very a heavy activity. Also, a number of grandparents will be looking after their grandchildren, not on a full-time basis, but on occasion. So those types of activities, we don't seem to be counting. We only can see the people who are out walking or biking or playing sports or something like that. So I really think we have to change the way we think, feel, and act toward growing older.
Thank you very much, Olive and Sherry. I really connect with everything that you mentioned. And in terms of how we need to change the way that we look at older adults and the expertise that they bring into the picture, I fully agree with you. In my team, in my research team, I have students who are high school students, and I also have research assistants who are in their 60s and 70s. And just watching how much we learn from these community experts and their expertise and knowledge, or even the dynamic of the team, is amazing. And that has been one of the best things that happened to my team in the past couple of years, to really have this wide range of age within the group. And so I fully agree with you that we need to change the way that we look, and then also the way that we incorporate different expertise and knowledge in our work. As the second question, there's also, okay, sorry. And as a second question, in what ways do you think society's expectations and stereotypes from aging differ for men and women? You touched on that a bit, but if you can touch a bit more, and what is one way that we can challenge these perceptions?
I I was always the only person, the woman. I was the only woman on city council when I was elected to city council in the early 80s. I was the only woman. I was the only woman in a Rotary Club, my first Rotary Club that I joined, and 4 men quit because of it. So I've been exposed to that for the last 50 years, basically, or longer, maybe. I can remember walking down the street one day, and I lived in Chilliwack, which was a small, well, it was getting much larger now, but it was a smaller community just east of Vancouver. And I'm walking across the street one day with a gentleman who was a business person in the community, and he really patted me on the head and said, there, don't worry your pretty little head about any of this stuff. And I'm going like, how do you even respond to that? You can't. I mean, there's no, but it's been, in my experience, my life experience, it's been trying to, and I think all of a sudden the same thing, trying to show, without talking about age, that women at any time in their life span have important contributions to be made, and all we expect is that we be treated respectfully, and at least that's all I think, respectfully for what I do, what I think, what I help, and all the things I do in community. My passion is community. That's where I spend all my time, basically, and not have to justify it because I happen to be an older woman. I mean, just don't deny the fact, but and then being able to do the things that I can do as the body starts to age and doesn't keep, and it doesn't keep up with everything else that's happening. So, and you touched on just for a minute about intergenerational activities, and I think, Paula, you touched about it in the workforce, where you get a much better result when you have several generations working together and learning from each other in a respectful way. And I really do think that this is coming. I see it. My children my oldest daughter just turned 60, so they're in that age group, and so they're at the stage where they're the older people in their workforce. So I'm hoping when my grandchildren get to this stage, that there will not be such an emphasis on the fact that you're too old to do anything that you want to do.
you
Okay, I
very
guess
much.
that's on to me. So there's always been a difference between men and women, how they're treated in society and what the expectations are. But as we grow older, of course, for women, they're really not supposed to look old. They're not supposed to have gray hair. They're not supposed to have wrinkles. And so companies are making millions of dollars trying to pretend you're not old. Um, so it's our whole attitude toward growing old that's impacting on that. Growing old is a life process, and we start from inception through until we die. And we don't look at that as, I think we need to look at the life perspective as we age and appreciate each stage of life. Another area there's a difference is men are considered distinguished when they get gray hair. Women are considered to be old and they better dye their hair to look better.
Don't dye my hair. I never have. Honest.
Yeah, either. And in the healthcare system, women are often looked at more as someone who's having a mental problem as opposed to listening to what the actual health care needs are. Nothing irritates me more than having an issue and a doctor saying to you at your age, what do you expect? Well, I expect help with my health. My age has nothing to do with it other than I'm more likely to have something happen. So women are often given medication, and this has been throughout society initially for women's hysteria onto their mental problems, which they really don't have. They're considered to be the caregivers. It's up to them to be the caregivers, where men might be the caregivers of the financial aspects, but not the hands-on caregiving. So I think it's the way we think about men and women and the role we think they should have. And when Sherry mentioned, talking about you look great for your age or something like that, well, none of us come with directions. We don't know what we're only aging once. We don't know what we should look like. So how do other people know what you should like or feel like when you're specific ages as you're growing older? Another area that I find and have an issue with is in research, we use a lot of different age groups for the younger people. And then when it comes to older people, it's the 65 and older. And yet those who are 65 and older represent 3 different cohort generations. And I've just done some research and I saw those cohorts so differently. And we've got to start, if nothing else, at least looking at the cohort ages, because the wants, needs, aspirations, dreams, values are all very, very different. So we need to start looking at what people really do need and how can we support that. Thank you.
Thank you very much. We have about 10 minutes, and then I really appreciate if the participants put their questions into the chat box or in the Q&A. So as the last question from our panelists, if Sherry and Olive, you can very briefly, maybe in a minute or two, mention 1 or 2 initiatives or community efforts that you have observed that combat gender ageism and what we can learn from them.
What came to mind, because we've covered quite a lot of that in our talk already, but what came to mind for me was that when we are celebrating achievements in our community, whether it's in the community or whether it's in your professional environment or whatever, and there are always opportunities to celebrate those achievements. I would hope that they would not be just the notice being placed, well, isn't this amazing because this person is 75 and they've managed to do blah, 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 whatever it is. And rather than say the achievements that have been achieved by this person are outstanding. and it's something for all of it, without mentioning age, because I think we just get obsessed with this whole business of age. I go around telling people how old I am because I want it to be made normalize it. Like, you can be whatever you want to be as long as you can do it. Sometimes you have to make accommodations. I've got some physical challenges that slow me down physically, but you accommodate it. And you're looking to achieve something in your employment or your passion or whatever it might be. And I think that also we need to make sure that we do not make the people who have chosen to stay at home or to look after grandchildren or to do the more traditional things that women have always done. Our society needs those things too. So it's not that everybody should be running out and getting a job when they're 80. But I mean, I think that's sometimes we sound like that's what should happen. But we should be appreciating and honoring the people who are doing the things that they're doing, not because they think they're too old to do anything else, but they actually choose to do that. I think that's really important.
Thank you.
Thank you, Sherry. Well, I'm looking at a number of areas. We need to be doing more intergenerational activities. I think that's really important. We've been siloing people far too long, putting our older adults away in this little box and making sure our younger people are not allowed to get near them. I think we do have to do intergenerational work. I think we're becoming more isolated through technology. And so one of the areas that I think is starting to improve things is AGE-WELL, which is a national body looking at technology to support aging in place. And they insist that all research have older adults on their advisory committee. And I think that is really, really important. So it's kind of a nothing about us without us type of thing, regardless of age. I also think the media has a big part to play in how they portray older adults. And I just want to give you a little scenario. I was at a conference once where this older lady was sitting at the conference table with her eyes closed. The media came in to do some filming to put on the news media. They zeroed in on this lady. She was quite frail looking. She was 88, quite frail looking, and she was sitting at the table with her eyes closed. So what did the world see? A frail little old lady at a conference sleeping. What the world didn't know was this frail little old lady was a retired pediatrician who had received her medical education at a time when women weren't even welcome in the medical field. And on top of that, she had a severe hearing problem from the time she was 18 years old. So nobody saw the struggles that woman went through. Nobody saw that she had been a successful pediatrician for about 50 years. What they saw was this frail little old woman that they thought was sleeping. So how dare they do that to older women? They would not do it to a 30-year-old. So, we have to get the media, who are very responsible for what they're showing to the public, that they need to be responsible for what they're showing. And aging is not a problem. Aging is a life process, and we have to start thinking about that. So thank you.
And I fully agree with what you mentioned, that we should have older adults in any research project and advisory in a really active role, and not just as a consultant.
Although they should be there from the beginning,
absolutely,
out through to the end, and they have no idea how much they'll learn from that.
I 100% agree with that.
Yeah, and this is what ageism, AGE-WELL is noted for, is that all their research is, and through the Older Adult and Caregivers Advisory Committee, which all of us on as well. And it's not just the members of that committee, but there are other older adults involved in reviewing these projects and research and so on. And I think that certainly for me, it's been wonderful because I get to meet all these great young researchers and give them an idea of what it really is like if they want to develop something that's going to make older adults be more independent as they age. But some of them just don't have any idea what they're suggesting is actually going to work.
Thank you very much. These are excellent. We have
I was just going to go
some
back.
questions. Oh, sorry.
Sorry, I was just going to go back, Sherry, to what you said earlier, as well as the idea too of not thinking of all older people as a single group. You know, there's clearly important differences.
Yeah.
That's excellent. We also have some questions in the Q&A that are really good. And I was wondering if we can touch on at least one or two of them. So maybe Paula, I would like to ask this question from Dr. Ann Hasters, that can you say anything about the interaction between sex, age, and class background and how internalized sexism complicates these issues?
Yeah, so I think this is the idea we were just saying is that you need to think, you know, we're suggesting that you think about sex and age as a starting point, you know, because there is that important differences with age groups. As Sherry has said, you know, when you think about children, you have infants and you have, you know, toddlers and you have all these various different groups. When you have older people, it's like everybody. And that's a huge, huge group. So it's important to look at those intersections, but it doesn't end at sex and age. And there's all these other pieces that we need to include as well. And so that includes things like socioeconomic status. It includes things like ethnicity. You know, these all add important bits of information that otherwise get missed. And they have big impacts, I think, in terms of some of the potential discrimination people may feel.
Thank you. You're absolutely right about that intersectionality. There's another question, again, maybe for Paula, that what is the single most important health effect on older women as they age?
I don't know if I can think about what the single most important health effect is. I mean, that's kind of a tough question to think about. You know, to me, one of the things that I think about, but just as a geriatrician, is that things aren't about single things. It's also often about complexity. So for example, as women and men age, but particularly women, they're, you know, more likely to develop different, what we call chronic conditions. So maybe there might be a little bit of arthritis, there might be a little bit of different kinds of conditions. So it's kind of not right to think about a single condition because that doesn't really necessarily characterize people as they get older. They'll have bits of different kinds of conditions. So we need to think about older people and especially women who are more predisposed to chronic conditions, considering complexity as opposed to single things, which is what you might do in somebody who's much younger.
Can I add to that? Because I think from what my friend and from my personal experience, the arthritis has been, for me, everything, you know, it's caused all kinds of other issues. Like I've had knee replacements, hip replacements, you know, everything like that for the arthritis. And then if you don't keep moving, then you start to become sedentary, and then that adds, so it, you know, that's a pretty important one. And the other thing with my friends is that we're all losing our hearing way more than
excellent. And this is actually what the focus of the EPIC-AT is, on how to look at older adults with multiple chronic condition and not one single condition.
Yeah.
There are more questions, but we are at 1 o'clock, actually 1:01. It was an outstanding talk and discussion. I would like to thank again Dr. Paula Rochon, Dr. Olive Bryanton, and then Sherry Baker for the very comprehensive and thought-provoking discussion, and also our audience for their questions and attendance. And we are also thankful for AGE-WELL, UHN, and EPIC-AT for organizing this, and looking forward to seeing you in other Elevate programs. Thank you.
Thank you.
Thank you. Bye.